Hello.
Good to see you.
Good to see you. I can't wait to see your presentation.
Oh, good. Yeah. Thank you. I think it went fairly well.
I'm sure it did. You're a beast.
Jet lagged. Denver had a power outage at the airport yesterday.
Oh, God.
So it was like almost a 4-hour delay for my flight.
Oh, wow.
It was so good to be back with traveling.
Yeah.
Thanks, Oh, thanks, Mary. I appreciate that. See, I know there's some technical difficulties in the other presentation, so hopefully Julie's here.
Hey.
Got our little love fest going here.
I
know, love fest.
My eyes are getting a little glassy.
Are you? That's great. Are you traveling, Julie? It looks like you have like a sprinkler system behind you.
I am. I just came up to Ogunquit, Maine for a couple days.
Oh, super. Super. We just got back from see if I can remember where it was, Maryland and Delaware and Pennsylvania. Got to see Kayleen's facility, Grow West.
Nice.
Yeah, in Washington, D.C. We went to our other member, Tacoma Wellness in D.C.
Cool.
Yeah, great to see so many cannabis nurses doing great things.
Yeah.
Hi, Catherine.
Hi, everyone.
Hi, Catherine.
I was just with Natalie on the patient panel.
Super. Hopefully, Mary can join us.
Yeah, so thank you, ladies, for joining us today, and everybody who's watching us. You know, we see that little eyeball in the corner top. There's 30 people watching us right now. So that is awesome that people stayed with us. I know people are in other areas. What I just reminded everybody in the patient panel that please, please, please go to the expo icon where everyone can see all of our supporters. You know, they're very passionate about the products they created. And a lot of them wanted to be live today so they can actually engage with all of our viewers to tell them why they created the product, you know, why they think it's superior, and talk about their COAs and what they really did to manufacture that product correctly. So please, everybody, please go to the expo sessions and make sure you check on each one of them. Some of them have videos, but some of them have live people on standby ready to answer questions.
Good stuff. I know Kelly's trying to get in right now, so we'll see if we can get her in. I don't know how to invite her in myself, or I would.
There's,
no, not me.
Hi, Alicia.
Yeah.
Hi.
How you doing?
Oh, fine. I'll be emailing you soon.
All right. Yeah. So I know at the corner it says moderation panel. If there's anyone comes up with a green cross in it, we just click it and adds them in. So we can do that with anyone that wants to join us and ask a question. We're just going to be here for a couple of minutes only because we want everybody to go in the expo. And I would love all of our Fireside Chat people to go into the expo as well and really engage with our supporters. You know, Leaf 411 wouldn't even exist without the philanthropy of these supporters. You know, this is a free public service. We want to keep all of our services free, and the only way to do that is, thankfully, the cannabis industry stepped up and said, we're going to support you. We want to make sure that everyone across the country can access nurses for free. Woo! And that anyone, no matter what their income level, you know, it's not based on, hey, if you can afford insurance or not, you get to speak to a qualified clinician. Here, it's for free. No matter what your income level, you have the same quality nurse guidance as anyone else. So we appreciate our supporters.
Thank you. Carrie and Natalie, if you want to try to join us right now. Catherine, I think you can let them on.
No, I don't see. No, I had just seen Alicia that I could let in, but I don't see.
And our nurses here. here. I think if you go in under, maybe if we click on their names here.
Yeah, anyone at the bottom left, if they're showing their name, you can click on that and it lets them in. But I only had Alicia in mind, so.
Let's take it.
People are asking, how do you get in? How can I speak to you? We're trying. There's also giveaways too, so I want everybody to go and do the go to the giveaways as well. All right.
If you have questions, certainly put it in the chat or the Q&A section. Happy to.
Yep. Anyone can join if you click the top blue button that says share your audio and video. Then your name should pop up in one of our screens, and then we can click on you and allow you in.
Where do we go for the giveaways?
The giveaways. Kazi has a giveaway, the post-survey event. If you go into that, oh, there's Michael Brennan. I'm going to let him in.
No, I'm trying to get in. Carrie, it has a limit, Catherine, of how many people.
Oh, sorry.
It's okay. That's fine.
Yep. Jen saying the booths have giveaways.
So, Carrie and Natalie, do you see a click share audio and video button at the top right-hand corner?
No, Carrie has said she does not have a blue button.
She doesn't have a blue. Yeah.
Yeah.
All right. The book giveaway will be announced in 3 minutes. Dr. Sulak's book. So that's awesome.
Carrie, go ahead and hit refresh.
Yeah, I had to do that actually in mine. I had to hit refresh.
Or go out and come back in, and Natalie as well. Love to get
Yep.
Up there as well. Thanks for your patience, Michael. Yeah, any questions you guys had that you didn't get a chance to answer or ask or get an answer from our panelists here, please feel free to ask them now. I know we did some lightning information there.
Oh, there's Carrie.
There's Carrie.
Yay!
When in doubt, always refresh with technology.
And now let's go to the expo.
All right, looks like we got a Q&A.
We got one.
Eloise, what was your CBD dose recommendation? Was that for neuropathic pain? You know how I'm going to answer it too, Maureen. It's usually, it depends. I do like to use CBDA a lot for the neuropathic pain, and I found anywhere from 10 to 50 milligrams seems to be a good range for people to try to get them into. A lot of my patients start out just at night for sleep and find it does help during the day as well. What is the best route to become a certified cannabis nurse? Hilda wants to know. Ladies.
Not yet.
Well, technically, there's no board board certification for specialty in cannabis nursing. There are a lot of different programs that you can do: Radical Health, Pacific College of Health and Science, just to name a few that are related to some of the people here. That help you to increase your knowledge and skills. And I know ACNA has this in the works. We developed a scope and standards of cannabis nursing practice. That was the first step. It's being reworked now. And so it is in the works for it to be an official board certification. But in the meantime, get yourself educated by doing one of those programs. So.
Yeah. And, look for people that you trust to be cognitive authorities in this information out there, because it hasn't been certified yet. Misinformation. Hilda also wanted to know, why are dispensaries resistant to working with cannabis nurses? Oh, I'm sure we have plenty to about this, huh?
I worked in a dispensary, and they were still resistant to me even when I was an employee. Oh, my light went up. But some of the reasons are a lot of dispensaries say they can't afford a nurse. They don't like nurses in the space giving health or medical advice. They look at it in some cases as a liability. There's a litany of reasons why, and then I think the biggest reason is they just don't see the value. A lot of people don't really know what nurses do, and they don't really see how we could benefit their customers and their patients.
And I know Julie and Caitlin have been working really hard in Massachusetts to get, as well as you, Marissa, to get more dispensaries to consider using cannabis nurses. And I know at Leaf 411, a lot of what we consider is how, you know, that's how we hope to get nurses in every dispensary, is by having the hotline and having that resource for dispensaries so that they can contact us. And, it's a little bit more economical for them. We're well paid. They're not used to those kind of salaries. But again, like Marissa said, I don't think they understand the value of what we can really bring.
Yeah.
So we're still really trying to create that for them. Yeah. Alicia said she couldn't hear me, but I think other people can hear me, correct?
Yep.
Yeah.
I think that's some of the work we need to do as well, is to really be able to provide evidence around our value and what we can do for patients and how that can benefit the dispensaries when patients are really happy and satisfied with their medical cannabis regime and what that means for the dispensaries as well. So I do think, as professionals, we have some work to do around being the ones that we demonstrate our value, right? We promote ourselves and go out there and get the work. And, what you're doing with Leaf 411 is absolutely amazing. It's a great model. You're welcome. I'm very proud of you.
Wow, thanks. I'm honored that you are joining us and support us. We've worked a long time. The idea grew, and I can't even express how much I love my profession. I have a niece that, asked, what should I do? I'm like, nursing, because you can do so many different things with it. And one of the things Eloise and I are very passionate about is creating jobs for nurses, and how do we do that? And then in the cannabis space, and then how do we, have a nurse in every dispensary around the country, even if that dispensary may not see our value. If we can make it to where it's affordable for them, and what's the greater goal? The greater goal is to have everyone, the entire public around the country, have access to a nurse. That's the goal, right? It's consumers and making sure they're using safely and effectively and reducing harm. That's our goal always. And I think nurses are the best, that can guide them in a very comfortable and easy way. So, that's what we're striving for, is with Leaf 411, is just trying to get nurses out there to show our value. Thanks, Julie.
Well, nurses are the most trusted too, right? So we're highly trusted, and what I've read, some of the things some of the patients have said about being able to contact Leaf 411, and just so much relief too that there's someone they can talk to and to have that guidance. And so again, being able to really, I think, you may be the leaders who can really quantify the value that your patients are experiencing. So, and then being able to share that with other dispensaries, we can help this movement to grow, that every patient has access to a nurse and every dispensary values and utilizes nursing expertise.
Yeah, and I think the way that we can do that too, we have to speak to dispensaries or the business at a business level, and we can show that we can reduce buyer's remorse because they're choosing the products correctly. We can reduce, bud tender or cannabis guides, whatever each state calls them, we can reduce the time that they spend with them because they're going in already knowing the products to purchase. You know, they're going in knowing the routes to purchase. You know, so many calls we get on the hotline, the callers are using the wrong routes. They're using the wrong types of products for the conditions they're trying to treat. You know, so I think when we speak to our industry on a business level, you know, we can show them our value that way. You know, an average sale might, you know, could be increased because they're getting the right product, and that's a loyal customer, you know, and that's what we want to show them as well.
Exactly.
Carrie, you're making me think we need to do a study.
I'd love to help support you with that, you know, looking at your outcomes with your patients and what that means for the dispensaries and their satisfaction and all those kinds of things. So I could see both a quantitative and a qualitative, a mixed methodology study. So that could be fun in that very weird academic way.
See if we can get some grant money for that.
Yeah, that'd be great.
So we do have our winner to announce of the signed copy by Dr. Dustin Sulak. And it actually is Alicia Diaz, who can't hear me.
Oh, she can hear you now. I think she got audio back. Yes.
Oh my gosh, I hope she can hear me. That sounds like so. Alicia, congratulations. Jen's gonna come in, and she's already put it there for you right now. How you'll get your copy, and what a treat to get that from him.
Yes.
And for those of you who are coming to CanMed, I'm sure he will be there to sign books if you have your own book. And that'll be another great learning opportunity. It looks like they just announced Dr. Russo is going to present his research on clinical, help me out here, cannabinoid hyperemesis syndrome and the recent findings from his studies.
Wow.
Great. All right, ladies. I'm going to pop off and I'm going to go join the expo and go into some of our friends there and our supporters and check them out. So I hope people do that as well.
Yeah, please check out our great supporters in the expo. And thank you again to all of you for your work really for 101. I know it's not easy, but you all did so well. And thank you.
Yes.
Attendees really appreciated it.
Yes. Thank you, everyone.
Have a good weekend.
See you in the expo.